Okay. Discussion 9. I'll start with question 1. What are the risks associated with MDMA and psilocybin? I'm not sure if I say that the right way. With MDMA, I know it decreases your senses, so um, you might not exactly know what your body's reacting to, like high increased um, blood pressure and heart rate. I forgot about and relearned about serotonin syndrome, which is like the overdose of serotonin that you could receive from it, and what that does to you physically. And the idea of the default mode network in your brain, which inhibits emotion and memory and self-concept. So those are more sensitized when you take it. And with psilocybin, I know if it's not monitored, it could become more of like a negative experience where it triggers like the opposite of what you want when encountering your PTSD symptoms. So it's really depends on the person's past experiences, their expectations of how the experience will go, like how the effects of it will contribute to whatever they're talking about or feeling. And then I know it's not like a specific time frame, so it could last from like 30 minutes to hours or even sometimes days if you're doing a certain amount. So I think for both of these, for them to be monitored would probably take it from being just pharmacological to psychotherapeutic, which I definitely think it could be both. Like I microdose mushrooms for my bipolar along with my medication. I think it does definitely help my overall outlook. It's such like a small amount that just like helps my mood stabilize more. And I definitely, yeah, I think that is kind of a challenging question for a lot of people, especially given I think about like the 60s and how psychedelics were viewed and how, it could still be stigmatized in that way, like it was back then. And it could definitely still be like abused, in my opinion, in a way, yeah, where I feel like that would deter someone from thinking that it would actually be helpful for their mental health. Um, and how can I legally and ethically talk to my clients about their psychedelic use? I mean, I think with my approach with most of my future practice, I would let that be like a client-led conversation. Like if they had some sort of interest in possibly trying out psychedelics and in a controlled environment, then that's something that we would talk about. I personally don't think I'm going to bring that into my practice. I would feel more comfortable with someone who's more knowledgeable on that subject and who has that as their like central point of their practice, I guess. I don't personally want to go in that direction. But yeah, I think like anything else, I would always just let my client talk to me about their experiences. Again, I guess it toes that fine line if you also want to talk to them about your own. I don't think I would personally mention that I microdose to clients because I don't want to like say this is my experience, it was great, when it might not end up being like that for them if they were to try it and become a whole thing. So yeah, I think overall I'm definitely more interested in learning about this. I've like picked at it over the years, but not necessarily delved too far into the topic. But it's such like a heavily advertised thing to me, even on just like social media, especially with like ketamine therapy being bigger now. I think I would like risks I would think of outside of just like psychological or physical would just be the idea that people think they could just do this without having assistance, I guess, especially something like ketamine. Um, yeah, I think, people go like with psilocybin, go in with like their own preconceived notion of what this will provide for them. And I think without like guidance, it could easily go the wrong way. Um, so yeah, I think those are my thoughts. I'm interested in seeing what everyone else thinks.